Hello, everybody, and welcome to our next topic, psychological tests. We've talked in general about how we measure different variables and concepts, and here in psychological testing, we're going to dive a little bit deeper into that. We're going to talk about different types of psychological tests, different domains of psychology, how they're used, and how they're constructed. So let's go ahead and get started. So let's start off with the use of psychological tests. Why and where are they used? Psychological tests are available in a number of ways. We have tests that are, say, commercially available or available to nearly everybody. So think like personality tests. We have some tests that are only available to researchers, things like diagnostic tests or intelligence tests, things that perhaps have a bit more weight to them in terms of their interpretation. And we use tests in all different domains of psychology. We use them in clinical psychology for diagnosis, educational psychology, child psychology, industrial psychology, and the list goes on and on. We use testing to evaluate a number of different phenomena. Most notably, or one of the most popular psychological tests, has been intelligence testing. So a lot of this lecture will focus around intelligence testing specifically because it has an interesting history and trajectory as a psychological test. So I have two striking gentlemen here, Galton and Binet. These are two famous scientists. Let's start with Galton. We'll go in order of history. Galton was the first to bring up the idea of basically measuring cognitive aptitude. And he said that we should do so by measuring the speed in which people could respond or react to a stimuli, like, for instance, a flashing light. Where this becomes a little more interesting is Galton was actually a cousin of Darwin, Charles Darwin, that famous guy, on the origin of species and natural selection, all of that good stuff, evolution. So Galton was trying to carve out his name in science as well, and he thought he would do so using speed of reaction time to measure cognitive aptitude. The idea here was basically that if the brain was more insulated or more wired and more quick to respond, that makes for a more intelligent person. Now we know that this isn't exactly the case now, though the brain and the quickness of responses are certainly related to intelligence and problem solving. But this becomes problematic when Galton was actually using this as fuel in the fire of the eugenics movement, basically suggesting that some individuals were superior to others in this specific sense. So then Binet came along sometime later, a couple decades later, and Binet said, hey, I think there's something to cognitive aptitude testing, and I think we really ought to do it, but we need to be careful. We don't want to label people incorrectly or unjustly. So Binet specifically set out to create an intelligence scale that would help children get placed in school, get placed at their correct academic level. But Binet's main fear, and he was vocal about this, is he was afraid that these types of measures would end up labeling people in a negative way. And he was definitely onto something. We're going to talk about how this type of testing became inherently problematic throughout time. But it's also important to notice that the Stanford-Binet intelligence test is one of the main intelligence tests still used today. So his ideas still persist with us in modern psychology. Galton was also a little bit interesting, going back to Galton and his crazy ideas. Now that we've gotten through our own data collection in this class, you'll appreciate this more. Galton had people come to him to give him data. He would basically set up at fairs and events and have individuals come to him and pay him money to do things like measure their height and weight, things that weren't readily available to people at home back then in the way that they are now. So you could say he was a little clever or intelligent in that way. So how do we test intelligence now? Well, we test it by a number of factors and domains. It's not as simple as responding quickly to a stimulus. So the Stanford-Binet, this is the organization of the Stanford-Binet, the 5th edition. This is a more modern or current edition of an intelligence test. And I just want us to take a look at the factors and domains that we have here because you'll notice that this is a multidimensional test. We have verbal and nonverbal domains, and then we have a level of factors. Fluid reasoning, knowledge, quantitative reasoning, and of course quantitative, right? We've talked about that in here. That's using numbers or mathematics, visual spatial processing, and working memory. So we have verbal and nonverbal components to each of these factors. So it's meant to be a more holistic approach, looking at multiple facets of intelligence. Now, we're not going to elaborate too much on intelligence as a topic here since we're focusing more on the research methods. However, there are multiple theories of intelligence, right? Hopefully you remember that from earlier psych classes. There are triarchic theories of intelligence where there's 3 major modes of intelligence. We have even greater categorical intelligence. Gardner had 8 total intelligences, with a few that maybe pop in and out circumstantially. But this is a modern intelligence test, okay? And we have these tests quantified. How do we quantify intelligence? Well, we get an intelligence score. We compare it to a normal curve, and now we're back to statistics. Intelligence has been standardized, meaning that we know what scores we would expect for any given norm group or any specific group. If you were to take an intelligence test, you would be compared to people like you, similar in age and other demographics. But here we have our basic breakdown on the normal curve. We expect an average. Remember, most people will score around the average. We have our normal curve breakdown, percentages in here as well. Most people will score around 100, and we have standard deviations of about 16. And then we have on the bottom here, how do we quantify it, or how do we essentially label or make these scores useful? Well, we usually have a lower end score that's meant to suggest some type of cognitive disability, and higher end of our scores leaning towards gifted or genius. You've probably seen these different terms before to quantify intelligence. So why are we worried about this? Why are we worried about the labeling here? Well, because it carries some social connotations. So this is how we categorize intelligence. I have then and now. Then being when the tests were first formulated, and now being the 5th edition here that we're discussing. If we look on the left, let's take a look at through these names, these categories that they've created for these different groups of scores. Everything looks good for the first couple of lines, right? We have genius, very superior, superior. And this is going back to eugenics, right? Superiority is not exactly a word that we want to use today when describing someone's intelligence. And then we have average, and then we start into some words that don't seem very nice. Sort of harsh and mean, but at the time, these words were actually crafted specifically for this, for labeling the intelligence of individuals. They got their connotation or their stigma from this type of psychological testing. So it's not nice by today's standards, but back then it didn't mean anything except for as related to intelligence. So then we have today's classification that we use to quantify intelligence or to categorize it. You can take a look here and see that these words are a little bit more soft to meet today's standards, but the same structure applies. This test is meant to place somebody at either an average level, a greater level, or a lesser level. So these tests through standardization are putting people into these different buckets essentially. And that labeling is important to know and to be aware of because it can carry social connotations with it. So that's where we stand today, right? But we still have to look back into history and assess how this type of labeling can be problematic and how this type of testing can be problematic. So what I have here is a graph from an old study that was done around the time of the civil rights movement. So we're back in history now. So IQ scores were used to assess the cognitive aptitude of children. That's what they had set out to do. Some researchers went ahead and did this. They gave intelligence tests to a number of children. This particular study was done in Harlem, and they were looking across 2 groups of children. They were looking at black children and white children. And the study was done to suggest that anti-segregation was not a good idea. They were suggesting that segregation should remain because combining students, integrating black and white students together in schools would be problematic. It would hold the white students back. And this is a graph they came up with, a figure that they came up with to illustrate this. Okay. Interestingly enough, the same argument is being made today, but reversed. That some people like the Black Lives Matter movement want segregation to come back because they believe that black children would do better with other black kids in the same classroom, which I don't think Martin Luther King Jr. would be happy about that, but it is what it is. So if we take a look, we see the general normal curve shape that we would expect, with both groups having means or averages toward the center. And we do see a specific discrepancy between our 2 groups. We do see that black children are scoring generally lower than white children, and this was used in a segregationist argument. So the problem here, what happened here is that there was culture embedded into the intelligence test. And by culture, what we mean is things like certain vocabulary that wouldn't have been known to black children at this time, as the tests were constructed by a different group of people. There are 2 examples of this that I think are quite glaring. One was about counting money, counting change. When after they took the test, children were asked if they had any issues, if they were having any trouble. The black children said that they didn't understand the wording on creating change for money, right? They use terms like quarters, nickels, dimes, and pennies, when in their neighborhood in Harlem, they were called 1 cent pieces, 5 cent pieces, 10 cent pieces, etc. So totally different vernacular, different vocabulary, as well as some vernacular, some of the vocabulary was specifically geared to those of higher socioeconomic status, words like yacht or catamaran, fancy boats that you might not know about if you lived in a landlocked area or lower socioeconomic status. So intelligence tests have been adapted, right? We've changed how we test for intelligence, and a large part of this is using culture-free tasks that eliminate cultural vocabulary, and hone in on more psychological variables. So here we specifically have visual and spatial examples. Of course, we can't completely eliminate the verbal components from intelligence tests, but they try to be more sensitive to cultural considerations. So here we have some culture-free tasks, and you should try this out and maybe post the answers if you can figure it out, but see what you can make of these, right? These are the types of tests that you might do if you participate in an intelligence test. In fact, many intelligence tests have a physical version of these, so you would be physically constructing these items in space. All right, so notice they have very little instructions, there's very little text, some of them have no text at all. This is to eliminate cultural impact on this testing, okay? So all of this really leads us to be careful with our psychological testing. I think a great way to think about this is through generalization. Remember, we talked about generalization a few topics back and how it's so important for our research to be generalizable. If it's not generalizable, it doesn't have anything to say. We can't make any inferences about larger groups or populations. So I think that this is a really apt comic to describe, right, fair selection. Everyone has to take the same exam of climbing a tree. So I think hopefully you get the joke here. But the question is, if a test isn't generalizable, if it's not accurate, if it's not valid, what's the point, right? That's why we need to be very careful with our psychological tests, especially when it comes to things like intelligence that can dictate somebody's career or educational path, or things like diagnoses. Getting a diagnosis is something very serious, and we want our tests to be accurate and generalizable and trustworthy. Now, intelligence isn't the only type of psychological test that we use. Let's take a look at a few more. I want to highlight a few others that are used in different domains of psychology. So personality is one. There are tons of personality tests to us. I love the MBTI. You can look at that at 16personalities.com. I'm an INFP. A lot of them are commercially available, so you can take them. You can Google personality tests, take them at home. Some of them cost money, some of them are free. Some of them we use for research, things like the Big Five personality inventory. That's sort of the gold standard of how we measure personality. And some personality tests that are used clinically as well, things like the MMPI, the Minnesota Multiphasic Personality Inventory. This is a more intense and involved personality test that can be used to help diagnose or suggest whether or not somebody may need some clinical intervention. It's like 700 questions and it's very expensive to take. We have inventories for depression, inventories for anxiety. These are scales, essentially, questionnaires that we can have individuals fill out, and it will spit out a score that suggests whether someone is depressed or not. One that we used a lot is the Beck Depression Inventory. And for some of you who are testing depression levels in your surveys, might have used questions similar to this. So this can quantify depression with a score in the same way that we quantify intelligence. Then we have career and aptitude tests. These are tests that suggest perhaps that you might enjoy doing a certain job. They're based on your interests and goals. And then we have tests that we see more frequently, maybe even in this class, achievement tests, think SAT or ACT. Tests like these are measuring your achievement, essentially your educational progress, and really they're just intelligence tests. They're like a version of the IQ tests. And then lastly, we have neuropsychological tests. These are tests that are related to neurological functioning. So these tests might be completed if somebody's had a traumatic brain injury or is experiencing some kind of cognitive impairment due to a disease or due to something like dementia. So we've taken a look at how we use them and some major types. Let's talk a little bit about how we construct these tests, what goes into making these tests. Now, I know we talked about this ad nauseum when we talked about measurement, but reliability and validity are essential when we are talking about psychological tests. So reliability, again, is whether or not the test is consistent, whether or not we're getting a consistent measurement. Validity is whether or not the test is measuring what it claims to measure. So this brings us to standardization. Standardization is a process, the general procedure or steps that we take when conducting or administering a test. We want to make sure that when we give a test to somebody that the procedure is the same no matter who's taking the test. That way we ensure every measurement that we're getting is comparable and we're consistent in the way that we're administering and scoring the test. Norms are sort of a byproduct of standardization. Norms are essentially the average performance of a particular group on a certain task or measure. And so because we have intelligence standardized, we know what the average intelligence score should be for, say, a 5-year-old, or we know what the average intelligence score should be for someone who's 50 years old. So we can compare an individual to their respective norm group to see where they're at compared to others like them. So standardization and norms go hand in hand. Standardization is the process of building that consistency, and norms are the data that we get from standardizing tests. Now, because we have norms, we have something called norm-referenced tests versus criterion-referenced tests. Norm-referenced tests are tests where the score is based on a comparison to others. Intelligence test falls into this category. We're comparing you to others like you. Criterion reference tests are tests where your performance is compared to a set standard or a set criterion. So think of it this way. A criterion reference test would be something like a driver's test. You're not being compared to other drivers. You're being compared to a standard of safe driving, right? Can you do this or can you not? So norm referenced, we're comparing you to a norm group. Criterion reference, we're comparing you to a set standard. So these are two different types of tests in the way that we might use them or we might interpret them. So another consideration when constructing psychological tests is what are we setting out to measure? Most tests have multiple domains. They're setting out to test for multiple different measures, so this is important to consider. We have item analysis. Item analysis is a statistical technique. It specifically takes a look at the items that you have in your test. Item analysis can be done in a number of ways, but we're basically trying to purify a measure. These are supposed to tell you how good the information is that you're getting from each individual question. You might have two questions that aren't exactly the same, but they're yielding exactly the same results or responses. So I have two examples here at the bottom. I enjoy going to school, and going to school is something that I enjoy. If we're getting exactly the same inner correlations between these questions, people are responding the same to each of these questions, then we can get rid of one. We can purify the measure and get rid of specific questions. So item analysis takes some other forms as well. Many of your instructors might do this for, say, multiple choice tests. I do this. You can run an item analysis and see what percentage of each question is correct. If you have a question that nearly everybody missed, it's likely not the fault of the students, but more of the fault of either the instruction or maybe how the question was written. So that's how we purify measures, making sure that we're getting quality information from each of the items in our measures. Now, you might ask, why would we put two of the basically same exact questions on a test? We like to compare the correlations between these questions to see if people are answering honestly, okay? If people are answering consistently. So those are useful to have, but then we might want to throw them out later if we find that the correlation is good. So lastly here, we're going to talk about how do we administer psychological tests? How do we give them? And specifically the qualifications needed and how you can get your hands on some of these tests. So I'll warn you now, you're going to see a big wall of text in a second. These are just the qualification levels for administering different psychological tests. So please don't write this down or, anything to that effect. But here we have them. We have 3 different major levels of qualification for different types of tests. So we alluded to this at the beginning. Something like a personality test might not need as many qualifications as we would need for an intelligence test or a diagnostic test, although the MMPI requires quite a lot of qualifications. So some are more complicated than others. So we have three general levels of qualification here. The first, level A, is no specific qualifications. Level B, we have a few instances here, things like master's degrees or certification or a license or some type of formal educational training. And then our last qualification level, level C, which is generally a doctorate degree in psychology or education or clinical psychology or something of the like. Also other licenses and professional certifications depending on the test. So I want to bring a couple different types of psychological tests to your attention to get you thinking about the different types of tests that we might encounter. So here's the first, the career decision-making system revised. You've maybe taken one of these before. Lots of high schools and even colleges will offer tests like this to get you on some trajectory toward a career you might enjoy based on the level of responses that you give. So here we have qualification level A. Anybody could give this. A public school teacher could give this. You might even be able to purchase this yourself and self-score it. There's no qualifications for taking this particular test. It does say it is self-scored. So the idea here is that this is a low-risk test. Of course, sorry, you want it to be accurate. You don't want it to send you on an incorrect path, but there's little room for professional interpretation of the results for something like this. So you don't have to worry about interpreting it incorrectly. It's low risk. Let's take a look at another, the BDI, the Beck Depression Inventory. We've talked a little bit about this in class as well. This is a very well-known measure. It's very quick to take, about 5 minutes, self-administered. But this is qualification level B. This is a step up because I think we might be able to imagine how damaging it might be for somebody to purchase this test for themselves and then determine that they fall into the depressed threshold. And then what do you do? If you don't have a professional to interpret or advise you what to do based on your results, that can be problematic or damaging to the individual. So that's an example of sort of a mid-range test. Okay, but notice that this is also 5 minutes, self-administered. This isn't a very involved psychological test, but the outcomes do have a significant meaning. And you can download this for free online if you want to test if you have depression. But keep in mind, again, the outcomes are significant. So you might want to make sure that you schedule with a therapist or something like that if depending on the results that you get. Now we have an interesting one, test of memory malingering. Malingering is an interesting word. If you've not heard this word malingering, it's essentially faking or pretending, for lack of better words, lying. So the overview says the point of this test is to discriminate between malingering and true memory impairments. True memory impairment versus malingering, or basically faking memory impairment. So naturally, this seems pretty difficult to measure. This isn't something you'd want to take and self-score, especially because we're dealing with malingering or lying, issues with the accuracy of memory. This could be a very legal issue. So this would be a qualification level C. We need a doctorate or a professional licensed person to interpret the results of this test. And usually they even need to go to training for some of these tests. So something to just bring to our awareness is that these tests are very expensive, or at least some of them are, especially the level C. These tests are expensive to create. They make a lot, they take a lot of work to create, to normalize, to standardize. So I just want to bring to your attention that these are not cheap. These are difficult to obtain. And I bring this to your attention for a specific reason. We're going to talk a little bit about intelligence, finish off intelligence since we have been talking about it. Intelligence tests are notoriously complex to administer. We do have qualification level C here. This will take 60 to 90 minutes to complete. And this is even short for an intelligence test. Some intelligence tests will take you all day, and that's not a joke. They can take up to six to 8 hours to complete. All the tests in certain intelligence tests, but the scoring options, if you take a look, it's a bit complicated. There are a lot of dimensions, a lot of levels in a test like this. We took a look at the domains and factors going into this test. So scoring is complicated, and rightfully so, because intelligence is complicated and has significant implications to the person taking the intelligence test. Administering it is complicated, like I said. There's a lot of things that can affect the outcome. Something as little as telling people your race can activate what's called stereotype threat, where, like, let's say you're Black and you're worried about the stereotype of Black people, and now this intelligence test has activated that stereotype, raised your anxiety, and then you tend to score worse. Things like the posters on the wall, like if there's a poster of Obama and you're Black, you'll score better. If there's a poster of Trump and you're Black, you'll score worse. So it's very complicated. There's a lot of rules for setting up the test. So I bring this up because intelligence is something specifically that can be damaging if misinterpreted. Just think about how damaging it would be to have your intelligence misconstrued to you, misinterpreted. You're smart, but you're told you have a lower IQ. So again, here it might be a little bit hard for you to see, but these tests are very expensive, thousands of dollars to get these tests. So what can happen? Something like this. This is an eBay listing for the type of test we're discussing. You can buy it now. You can purchase it, have it shipped to your home. This is, of course, unethical, maybe even illegal. You're not supposed to be able to get your hands on these materials unless you're qualified to do so. But I want to point this out because we should be very careful about the origin of results of psychological tests. If somebody purchases this and they're not qualified to interpret the results, getting information from them might be unreliable. So there are multiple reasons someone might do this. They can make money off this, which is not good. It's not ethical. And they can also bypass those qualifications to use information like this in their research. Okay, so thankfully we do have ethical boards in place, kind of safeguards, from preventing this from happening. But here's an example, you can go on eBay, grab one, test yourself, and that could be inherently problematic. Okay, if you ever do that, first of all, you're wasting your money because it is unreliable, and then, you might be misinterpreting things for yourself because, again, it is unreliable. Okay, so that was our overview of psychological testing. I hope you enjoyed it, and I will see you over on our next lecture. Bye.